We're so lucky to have Frost & Sullivan as one of our strategic partners because the information they are going to give you will be invaluable. They are here to share with you some significant research that is critical in determining your markets and channels. So let me introduce to you Zachary Bujnoch, got a lesson on how to pronounce the last name, is a research analyst with the Frost & Sullivan North America healthcare practice. He focuses on monitoring and analyzing emerging trends, technologies, and market dynamics in the patient monitoring industry in North America. I'm going to let him speak.
Hey everybody. So who's ready to hear about some markets? My name is Zachary Bujnoch. It's said a lot of different ways. It's okay, the last name. No. It's I from a small town in Texas, and even there they say it whatever way they want to. It's not really a consensus. But anyway, so I'm a research analyst at Frost & Sullivan. For the past about 5 years, I've done research in this particular area. I'm originally an engineer and in monitoring and things like that. But we realized at Frost & Sullivan quite quickly that our clients really wanted to know about this stuff. There's a lot of things going on in telemedicine, telehealth, and connected health. And I personally have not been able to get out of it once I started doing research in it, just because of how much the information was needed. So what we'll be going over today is identifying and establishing markets. The real need we see more than anything else in this area, and I'm going to be talking toward telehealth is my term of choice. It really, and we'll go through some definitions to kind of get on the same page later, but that is really, in that area, there's a lot going on. And obviously from the panels we've had today, that's pretty obvious that it's just massive. And what we're tasked to do more than anything else is to help our clients identify which one of these are going to make money, which one are going to be successful and change healthcare. So that's really what the goal of the presentation today is. So I'm going to do a first couple slides on really just defining and scoping what we're going to do, because you really have to get an idea of what we're talking about and really kind of get on the same page. This is the only text-heavy slide, I promise. It's really just some definitions and basic backgrounds. Telehealth, the word I'll be using for this whole presentation, is kind of my scope-all term. It's communication technology used to give healthcare at a distance. Pretty simple, but pretty broad. Another terms I'd like to make a differentiation between is telemedicine and telehealth. Telemedicine is typically looking at the curative aspects of this remote health, but when telehealth is kind of a broader term that looks at all of it, curative, preventative, and wellness. Really, to sum up this slide really fast, a lot of this stuff is not new. Some of this is new. We will go to some of the markets that are new, but some of these have been around a very long time. I would say the origins of some of what we do is with Dr. Holter, who invented the Holter ECG device a very long time ago, 50 plus years ago, where you walked around and it measured your ECG, and you got to walk back in and the doctor would read it, and that's still done to this day, but in many ways in a much more sophisticated way. And also, as we've shown, telehealth is effective in a lot of these pitfalls that we have in healthcare, but it just has to be done right and targeted right. So here's the main slide of the introduction, and all of this is in the binder as well, but this is really kind of our best way to scope and define what we look at and what we'll be talking about today. The top three bubbles, industry verticals, are the three core areas of what telehealth does. And those are video telemedicine, which is pretty self-explanatory. It's use of video in healthcare. For medical applications, we're not talking about business applications that hospitals might use video conferencing for. This is for some sort of diagnostic or preventative event. Remote monitoring is the oldest and the most established. These are the aspects of monitoring in the home, all these things that that obviously have been discussed before and will be discussed much more. And the last one and the newest one is mHealth, or mobile health, which has varying definitions from regions in the world. But in the US, it's pretty focused around the use of broadband-enabled devices, so that can be a phone or a tablet, to provide some sort of healthcare service or product. And that's dominated primarily in the US and Canada by app stores. When you go someplace like Africa or India, you get a very, very different world of mHealth. For example, in Africa, it's the infrastructure communication structure of choice. And so it really just becomes a communication tool exclusively just to communicate data, where in the US with an app store, it becomes very different. And then finally, general health IT. Obviously, that is a very important aspect, this information technology aspect, like medical records and things like that. But it is an indirect portion of telehealth and telemedicine. It's not always the case. It's sometimes just a repository for information. But it can't be ignored because it's a key part of this. And I'm going to really run through these next slides pretty quick because I want to get to the core of the presentation, which is an excerpt from our upcoming study around telehealth. These next 3 slides are going to introduce what we use as our telehealth matrix. We used it for a couple years now, and it really plots 2 axes on telehealth in various ways. In this case, we're going to be plotting the markets themselves. The first one is who's your user, who you're selling to or who's using your device. And that's professional versus consumer, which we've talked about a lot. But really, telehealth is really straddles between these two, but a lot of things change based on where you're targeting your product or service on this spectrum. And then the second one is between the 2 major industries that are at play here in telemedicine and telehealth, which is healthcare and information communication technologies. There's obviously some very, very stark differences between these 2 markets. The easiest example I like to give is that in marketing, in ICT and in healthcare, you can't market anything until it's approved in the US by the FDA. It's legal. And in ICT, they market things before they even exist. That's the nature of these 2 markets and how they really are polar to each other in a lot of ways as far as business activity goes. And then this is a slide that I could spend the whole presentation on, but I'm really going to just pass over it for the most part. Here we have the top 20 markets plotted on this by what we decided what they would be on these axes. And as you can see also on the areas that are outlined on this, in the top right is traditional healthcare, very professional focused usually, very healthcare industry focused. And on the bottom left is more of your non-healthcare approaching kind of markets that are more fitness and wellness, things that are more focused on the customer and also have more influence by the industry of information communication technologies. There's not reimbursement, there's not FDA approval in this section of the graph. And in the middle is the core area that really is this undefined kind of blob area as far as markets go. And to be blunt, really is not the most successful area for a lot of these markets so far. The highlighted ones are a little sneak peek of the most successful ones, the ones in brown, and those are not, as you can see right in the middle of this graph. It proves to be very important that you need to you can't go and straddle it and get a 5 out of 10 on this. You have to identify who your customer is and what market and what your business models are. You can't kind of do everything at once. It's kind of the takeaway I would give there. So here we go. And I'm going to give about maybe 15, 20 minutes on Q&A. I'm really trying to get to the core of this, spend a good 20 minutes on these slides here, and then really, keep your questions in mind. I'm going to be throwing a lot of information at you. There's plenty more I can talk about on any one of these slides, so a lot of time for Q&A later, so keep those in mind. So this was an exercise we went through from an upcoming study that's going to size and explore, define telehealth as an industry as far as the actual revenue. So really what it comes down to for what I have to look at is that what makes money? What are these things actually making money? Some of these things are good ideas, but do they actually make money? That's what it actually comes down to in my day-to-day. And in this, we've identified these markets, and then we put 5 criteria to rank against them. Now, this is not against everything. This is against themselves. So the average of this would be a 5 out of 10 for the market that was ranked right in the middle. The 5 criteria are current opportunity. So that is revenue right now. In this case, 2012 revenue for first half of the year and estimated for the second half. And this is based off of Frost & Sullivan market sizing. Actually, in most of these markets that we'll be talking about, we have dedicated public studies out there that have these sizing numbers, or we have them in our own proprietary data. Second is short-term growth, and these are all weighed equally as well. Short-term growth, which is really 2 to 5 years, really focusing on the next 2 years, and it's based off of Frost & Sullivan growth forecast, which always forecast out at least 5 years. And then third is long-term growth. This is more of a 10-year, long-term kind of view what is really the market potential of these markets rather than what is really growing. So how big can they be? And then fourth is one that's not based as much on our numbers. It's really how much each one of these markets are poised to transform the way we do healthcare, to really transform patients' lives and how doctors go about their day-to-day and other healthcare providers. And the last one is our business-focused one. It's really best business models. So that is each market in these, a lot of these are based off of pilots, demonstrations, things like that, which are not sustainable business models forever. They need to prove what they're going to do, and actually in most cases, it's been pretty hard to do that for some of these markets. So this is which markets have sustainable business models, have business models that make a lot of sense, or are looking to have that pretty quick. Again, these are all for North America, which includes US and Canada, and they're all ranked against each other at a ranking of 1 to 10. And so for those of you that already looked ahead, here's the first market, home healthcare and disease management. What is this? Home healthcare and disease management is the idea, it's been around about 20 years in its current form, where you have like post-discharge care, where you have a 30-day readmission criteria, you're trying to send patients home with some sort of monitoring technology, and then is interacted with a coach or a nurse, and then try to keep them from going back into the hospital. It can also be a disease management program that goes for as long as something like 9 months, where you have criteria along that way. This is in the remote monitoring section of the vertical, so it's typically not video at all, especially right now. There's some dabbling in using video in these technologies, but usually they're basic stuff. They're blood pressure monitoring, their scales. As you can see, this ranked very high or high on all categories, was actually almost a full point, or was a full point higher than the second placed one. And I think this really reflects the need that this market really addresses as far as healthcare patient and physician needs, which is there is a stark need to improve the transition of patients as they move through a healthcare system. That can be from discharge to home, that can be from discharge to nursing home, that can be discharge to a physical therapy facility. And right now it's pretty bad, and that's your last chance as a physician in a lot of cases to really have an impact upon that patient, and it's right there next, it's something that's actionable to do. So that's really what the need is looking at. This has very mature market characteristics. It's been around for a while. It makes over $150 million in revenue and in 2012. And so it has those proven business models that work. And there's a lot of different ones. And they have and the need is so high that they have worked. The other thing that it has is a whole lot of opportunities for growth. And so that's what it has. It has this opportunity to growth along with actually having stable business models right now. So you have the best of a mature market and the best of an emerging market all in one. But moving on to number 2, remote specialist services. This is a little harder to define. So what we're talking about here is video-based services for a provider, for a hospital that doesn't have resources on hand. So it's a hospital outsourcing, and this is actually the newest and the smallest of all the markets, and they're in the top 5, which we'll go through. And what this is, so for an example, you are, you need a neurologist to identify or to do a diagnostic consultation on a stroke victim, and some medication needs to be done in the first 2 hours of that stroke to be able to prescribe it. You don't have that neurologist, you don't give that care. So this is the idea of hiring someone that you would outsource out that specialist to come in through video conferencing to provide that consultation. So it's a really interesting idea, and it kind of and it's already done quite a bit in specialist care, things like neurology and cardiology. And so what this does also that's very interesting around business models is you're really implanting yourself inside the healthcare system's existing business models, where they need to provide this service, and if your cost-effective way to do that, to do it effectively, then that's your business model. And they do that quite a bit already. This is same with something like radiology, where you outsource or a second opinion on an image. But this is a very interesting market, especially when it comes to long-term potential and how much it can really transform the way we do healthcare. Third is personal emergency response systems. Now, this is something we might not, the conference might not get to talk a lot about, But this is here first and foremost because it is the largest single revenue of any kind for patient services, healthcare services, period. It's paid for by the consumer directly. It is not reimbursed. It is also not FDA approved. So you're talking a consumer-oriented market. Companies have a lot of the companies have picked up on this. There's been an increased amount of activity, but you're talking, you know, the other markets are all $100 million markets in the U.S. This one's over $1 billion in revenue every year, and it's growing. They figured out ways to make it grow, even because not because units are growing. They are with the population of people that this addresses, 65 and up, but they're growing also because they're figuring out ways to charge more for these services by providing very basic technology advancements. The idea would be, you know, an accelerometer. Fall detection was a big deal about 2 years back. Not a very fancy technology, but allowed them to charge $5 to $10 more per month for the patients, for the users, and that translated into quite a bit of growth. Short-term growth is low. Long-term growth, it's going to be around. It's going to be big for quite a long time. Fourth is video consultation. This is the sister market to the video conferencing earlier. This is your traditional thing. This is when you are trying to extend your reach of care as a hospital provider or what have you by providing video conferencing at a remote location. This can be done from anything from prison systems trying to provide healthcare to remote patients to a hospital just trying to expand the reach to a remote or unserved area. It doesn't have to be remote. That seems to be the idea, but that people think of. But it can be. There's an increasing amount of urban use of this because it's really an efficiency thing. It's not always that you have to drive. You know, in some places on the East Coast, driving 2 hours is not driving very far. So it's those kind of mentalities and really trying to put the patient first for an ease of access kind of need. It's very high. It's a very established telehealth market. It's still a moderate, but it does have over 100 million in revenues right now, and really just a staple, you know, core pillar of what telehealth and telemedicine is and is always going to be. And then fifth, kind of snuck in there with some very, very high and then very, very low numbers is remote cardiac services, which I mentioned Holter monitoring earlier. So in the last about 5 to 8 years, there's been this emergence of advanced remote cardiac services that are a combination of existing technologies that, through communication technology, monitor your heart all the time for about 7 days. Before, it was an intermittent event monitoring that only monitored when it was triggered. This monitored for 7 days. It was better than what existed, obviously, but the big story is that people paid much more than the ratio of how much value it added. Just because it added 3 times as much value was the marketing slogan from some of these things, which it did. It was a clinical study and good enough. But they paid about 10 times as much for that service in the end. And this is about the opposite of personal emergency response. It's fully reimbursed, fully diagnostic service, you know, done remotely. So very high opportunity, not as high as PERS, but still quite high, and very, very established, very, very real business models that make. So basically, this was a market that went from 0 8 years ago to, you know, 300, 400 million, whatever it's at in 2012 kind of situation. And so I'm going to kind of fly through the last couple. Those were the 5 main slides I wanted to get through. These are some other fun awards I thought I'd put on for the top 20 markets. Rookie of the Year Award was for hosted cloud infrastructure. This has applications in various different markets, even the ones I just discussed. It's different for each one. Imaging, hosted cloud infrastructure is different than video consultation. But it was a very new market that scored very high on the list as far as revenues go. And then over Hype Award, I didn't mention, but some of the information on this is due to surveying we did to users and vendors in telehealth. One of the questions we asked was which market was most overhyped out of the 20, and health information exchange won pretty hands down. Doesn't mean that's not an important market, but that was what people said, pretty straightforward. What should be included next year was telemental health. This is something that vendors didn't really see a lot of when they did the survey, but users did. And it is obviously in the VA, for example, they do a massive amount of mental health for post-traumatic stress, and there's plenty of revenues associated to that. What might not be included next year was texting informational services. That is last on the top 20. I think that might be a little bit of an error because, several people have mentioned texting informational services already today, and it is in a very important way that we're going to reach out to people that don't have smartphones, that are just texting-enabled phones. It's a very cheap and powerful and scalable way to do some of these behavior change. And then finally, under the vendor radar, as wellness and behavior management programs, it's really been what people have talked about more than anything else at this show so far, and probably will for the rest of the show. It's something that the industry and most of the providers really don't, especially the larger you get, are really starting to finally pick up on that this is the way we're going to do this behavior, this change in healthcare is through changing patient behavior through programs that are designed to change patient behavior. And here's the total ranking. It's in the book. It gives all the things, and feel free to ask around any of these in the Q&A coming up. And then this is the final slide before there's kind of an appendix of some very basic information and some contact information. So here is one question I thought we could put up from the survey that illustrated, I think, a pretty key point. So as I said, we surveyed both vendors of telehealth of all kinds and users of telehealth of all kinds. And we got some pretty decent responses in this one. But at the last minute, we said, okay, let's ask one question to both groups. And so what we got was this question that asked, what disease state holds the most opportunity for telehealth solutions? And what we got, the most interesting, was very different answers. What you got from the vendor side is based off of business opportunity. It is which diseases have the most people in it, which ones cost the most, and it goes right down the list: cardiovascular, diabetes, general wellness, mental health, etc. What you have with the user side is very different, and you still have pretty decent cardiovascular and diabetes, but general wellness ranked very high, and so did mental health. That ranked actually incredibly low on the other one. So it gives this kind of perception that, maybe it's something that will always be, but there's a stark difference between someone who's looking at the clinical needs and someone who's looking at the business needs. And then the appendix is just some basic defining information around the three verticals, and then some extra information around some of the key ones that are a little different, and then contact information. And now I have about 18 minutes and 25 seconds. I wanted to just give you guys a chance now to ask questions around any of this stuff. It has a big "and" in the thing that says "and ask the analyst," so I wanted to make sure I gave plenty of time to have anyone that wanted to ask any questions. If not, I'm an analyst. I can sit and talk up here as long as y'all want.
You are the expert that cover the entire universe. For us, maybe it's more relevant to ask you a personal question. Suppose you have only one chance to start a company. Which area would you focus on?
Sure. If you're going to put it a personal question, what I would choose is the markets that I would approach and try to start up, and would be the ones that have the most transformative potential in healthcare. And I think the biggest one that you have around that is the remote specialist services, getting together, physician a group together. I might not be personally qualified to get that. That's usually someone who knows is pretty well ingrained in a physician group. But getting that group of physicians together right now is what a lot of people are doing to provide remote consultation, because it just makes a lot of sense. The other one that is basically what everyone is talking about here, these behavior change modification programs, and they still have a long way to go, to put very bluntly, but those are the ways you change behavior. And as was said many times also, behavior change is something that is, let's put it this way. In healthcare, there are three aspects. There's diagnostic, there's biological, and there's behavior. Those are the three aspects of providing healthcare that you're taught in med school. And we do the first two really well, to be blunt. We always talk about how we're doing things bad and how the bad numbers are, but we do those really well now. What we don't do well at all, especially in developed countries of all kinds, is behavior. We don't manage behavior at all in some cases. But we do diagnostic and biological and anyone else. So it's really these things focused around patient behavior that are effective. They were saying earlier that we're in the time of, I forget what it was, but the time of trying out new things, experimenting in the market. But what we really are right now is the time of proving the market. I mean, that's where we're at. And then once we start proving, I mean, I want to, I want an employer to put up that information that we're talking about that says, yeah, it saves money, it saves all my money. Here it is right here. Everyone should be doing this and presenting it to the people that matter. I mean, we're at that proving stage right now. It makes sense, we get it. Now we have to prove that it works and validate, all of these conjectural things. Anyways, long-winded answer, I would do behavioral modification programs.
Hey, thank you for being here. Mark Wax, Johnson & Johnson. I have a question about your rankings. Diabetes management sticks out to me. Number 10.
Yep.
It's behind a couple things I probably would never have thought it would be.
Yep.
I was hoping you could speak a little bit on that and sort of where you think the opportunities are and perhaps why it's ranked so low
Sure.
considering the growth of the disease.
Sure. So to scope that a little, or to clarify that a little bit, these are the top 22. So everyone on here is a pretty good opportunity. There's lots of markets that didn't make it on here. I didn't discuss personal health records, for example. There's a lot of things that aren't on this top 20 list that are in the 50s, or because there are that many micro markets around here. Now, directly to it, the scoping of the diabetes management aspect of this is only diabetes management that falls within the scope of telehealth. So it has to have some sort of communication technology involved in it that does a lot of things. And the issue with that market in particular, is that it is just there's been a lot of attempts, and there still are companies out there that are trying to put together short-range wireless devices or devices that log into apps and all these type of things. And some of them do them very well, and some of them have stalled completely. And it's just, what it ends up becoming is a competitive landscape kind of issue. Diabetes management is an incredibly difficult market to get into if you're not in it. It's very, very, very competitive and in some ways kind of small. There's 4 or 5 companies that make up the bulk of it, and that really was actually one of the big reasons why it got pulled down a little more on the list. And actually the revenue attributed to those additions of technology to diabetes management is not too big either. Diabetes itself is huge, but it's not the technology, to put it blunt, around diabetes. Diabetes is about strips. You make money by selling the testing strips. You don't make the technologies given away for free in most cases, as far as when you look at the overall numbers. So this is kind of the conundrum of diabetes monitoring around this stuff is, okay, this has to make me sell enough strips. Well, if it's a really nice piece of technology, it's going to be $40 extra from the zero it was before, or 20 or whatever, but it's going to be an increase in value in dollars to provide an advanced device for diabetes. You have to match it with value. So diabetes management is obviously got a lot of interest around many companies, but it's a difficult nut to crack, and there's a lot of companies out there that are doing things like that. And I try not to mention any companies specifically. If you guys want me to, I can just start rattling them off, but I try to keep the third party going here. But anyways, is that good? Go ahead.
Hi, this is John Kuhn. I'm with the Medical Electronic Device Solutions magazine. So we write about the technologies, we write about wonderful products. So my question to you is, everyone seems to be offering some wonderful products like ECG monitoring device you can wear,
Yep.
and then a doctor can be notified 24 hours a day. And then somebody would wear another glucose meter or something and then inform the family members and doctors. So my question is, what do you see from your perspective? Obviously, the doctor is not going to have 50 devices monitoring one thing here, one thing there. What do you see will happen in the institution, hospital, or doctor's office? Are they going to use one device, 2 devices, or a central device to monitor people?
Well, the quick thing around that is centralized monitoring is something that's done in hospitals a lot already when it comes to acute care things. But I think what you're talking about more is, as you start extending this umbrella of care outside the walls of the hospital, for example, you're going to start getting more information. And basically, the way I would answer that is this kind of idea that I throw around sometimes, which is what we're really talking about here is taking the responsibility off the doctor. It's the age of the doctor is over, is my one-liner around it. And what that means is that we're pushing responsibility down the professional chain of healthcare provider individuals and actually creating new positions, things like that. So what ends up happening sometimes for a home healthcare agency or a home care type of situation is you have those individuals that monitor all this stuff, but a doctor never sees all that, or they see only it in the most extreme situations. And so you have this kind of hierarchy being established around these types of information and having the appropriate people involved that know what they're doing. It'll be interesting to see, and basically this is true around all things. Most professional degrees now require a doctorate when they didn't. Physical therapists, pharmacists now all have to have a doctorate as opposed to a master's before. And then the invention and emergence of new types of things like a health coach and things like that. You're seeing this just enormous broadening of responsibility, and it's a mixed case for doctors. They like the responsibility, but they don't like the responsibility at the same time. But that's what's happening right now, and that kind of is that's the infrastructure that supports these type of devices. Now, giving an ECG into someone's hands and having them do it, there's never, that's a different world. But if you're pushing information to somewhere else, which is what a majority of this stuff does that's effective, that's what's going to rely on this type of infrastructure. But anyways. Any other questions?
Hi there. Quick question for you. Laura Lindsay to Sullivan Phillips. If you have a traditional healthcare media company that wants to get more involved in telehealth, what do you think the opportunities are for them?
So, healthcare media company?
Yeah.
All right. So, I think this conference hits on some of those sides of it a little better, where you're talking websites and you're talking patient engagement. As you can see, actually, that's something that I didn't focus a lot on in these markets. It's really this separate world of a business. When you're talking about this marketing aspect of telehealth and telemedicine. And so in that, I would say that a lot of what people are talking about here is very good engagement activities but what you really have to understand around it that would be the best is understanding how the value is provided for each one of these things. It gets really lost right now, and a lot of the marketing out there is really indirect. And I as a person who gets marketed to constantly, everything that I deal with is some form of marketing, usually when I'm talking to people, unless it's very casual. There's underlying themes to those things, and right now there is a lot of misinformation around it, a lot of issues. For example, as someone who doesn't know healthcare very well, like an ICT company or a telecom or something like that goes into healthcare and tries to do marketing that way, they need guidance on how to do those things from a healthcare point of view where it makes sense. You can't put a website up that has them interacting and reporting ways they misused a device. That's an FDA reportable event now. There's all these little issues around healthcare that are very unique, and that would be actually my advice would be that there's a lot of, actually what we have to deal with too, there's a lot of people that don't know anything about healthcare that are involved in these markets. Personal Emergency Response Systems has security companies that don't know anything about healthcare. They make security systems, and examples go on. So there's a lot of people that don't know a lot about healthcare that need guidance on every little piece of the puzzle to make these very complicated systems work.
Yes, can you address a little bit the current and future opportunities for reimbursement for telemedicine?
Sure.
There's a lot of problems in that arena, and I'm with the health center that I
Yep.
addressed earlier. We're getting grants to deal with health teleservices because there's no money
Yep.
to pay us for that.
Yep, and so a lot of what I talked about, especially home healthcare and disease management, those are markets that are in the flux of, okay, they're a traditional healthcare service, but they don't fit into fee-for-service model. It's not ECGs, that's a single diagnostic event, fits in reimbursement fee-for-service. Doing a wellness system, doing a monitoring system at the home that has scales and blood pressure cuffs and is customized to every person in every region, not so much. So there's long-term things going on like bundled payments and things like that that are being explored, which again might all change over the next month or two with some of the litigation. But the idea there is that you have, basically for some of these things, I'm just going to be very quick around it, they'll never be reimbursed the same way that you reimburse other things. The origins of home healthcare, for example, came from 30-day readmission bonuses that you can get for keeping patients out of a hospital for 30 days. And you can do that, and now they're extending that to, I think, 60 days pretty quick, I think, in this year. And so there's models around that. There's models around, you're going to save money on this. And in some situations, say you drive and spend a lot of gas for your nurses, it will save money hands down. But it's really you go to any conference that does telemedicine, telehealth like ATA, you'll hear about reimbursement all the time. And it's really at this point a moot point. It doesn't work for some things. It just doesn't, and it's going to be a pretty long time before the system changes to make it where it doesn't work anywhere for that. It's a very complex, diverse system. You have something in San Diego is different from North South Carolina. It's not the same population of people, and each situation tends to be kind of its own custom thing. So unless you can standardize it down to a simplistic thing like a remote ECG, reimbursement's pretty tough to do. Now, basically my advice around it would be, you have to figure out other ways to pay for what you're doing. And ACOs have shown interest in these type of things more and more. Other things like that are coming around that this conference talks about quite a bit. But reimbursement only works for some things. And in remote monitoring, it worked remote cardiac monitoring, it worked very well. And personal emergency response systems, I've fallen and I can't get up type of systems, they never did it ever. And they make more money than all the other markets we discussed.
Hi, you mentioned that the behavior modification was one of the areas that was under the radar but potentially going to grow over the next years. I'm kind of curious if there are any companies in the space, or if you don't want to name the companies, any types of behavior modification programs that are working better than others.
It really comes, so there's the kind of overall things like what people will show here that are, informational services that promote action. But there's also the regional, becomes a regionalized offering by a healthcare provider, and I'm not, know enough to name all of those. There's a lot of them, and some do better than others. But what ends up happening from a healthcare point of view, which is the way healthcare system is in the U.S., it's a big, diverse place. It's a very big, regionalized place. Is you have different pieces that do pretty well, and some programs that don't. An easy way to go, you can American Telemedicine Association, which I mentioned, has some of the people involved with that as sponsors and stuff are some good community programs, because that's what ends up happening around a lot of these health modification programs from a hospital point of view. Other things that I didn't mention around this too is the aspect of doing a consultation for a physician remotely just through a phone. There's several companies that do that now. I'm blanking on the names because they're very similar, like a lot of the companies here. Health tends to be in them and things like that. But anyways, they provide a service where you can get an app or go to their website and get a consultation from a physician through video and get it reimbursed. There's that aspect of this too that's very interesting, and is kind of a critical part to these health and wellness programs as far as like getting a real healthcare service. The idea in some of these is that, so for example, you're an ER doc. I think the statistics go 70% of all ER visitations are not emergencies, period. And so getting one or two of those people not to go to the ER for their basic stuff because they have nowhere else to go is a win, is just hands down. So you can do that through remote monitoring and things like that, through a wellness program designed around that. The hardest thing to answer around the question is that is the most undefined of all the markets we have here. It really hasn't coalesced into a very stable business model. They go all over the place. It's really actually the thing I'm going to dive into next for the rest of the year to try to see if there's some definition to that market right now, because right now it's just everything and anything under the sun. And we can talk more about it.
Dan Shirobi from Excellent. When you're pulling data together, typically you'll come across something that is a big surprise. In other words, something you were looking for that didn't come out, or something that you didn't think would appear and it did. Was there a big surprise?
Sure, all the time. You hear a lot of marketing things, and then when you sit down and try to put basic numbers together, prices times units equals revenue type of stuff, and you see things are drastically wrong. One number that keeps getting thrown around a lot is the 30% of professional use of mobile health applications. We actually found that that's a pretty straightforward number as far as revenue goes. I'm not sure of the line of that number's origin, but it could actually be from some of our research. to begin with, but we did an assessment of the revenues for apps. And when it came down to the revenue of apps, 30%-ish of the revenue was from professional designed apps. Those things like Hippocrates, mostly that type of medical lookup type stuff, or news type stuff too that could be embedded in them. That was always really interesting. I never thought, and the other thing about it was that 70% are paid by consumers right now, and the cost of those things on our average was like $3 per app download. Or because there's a lot of freemium type models in that, but still 70%, a very large chunk of revenue was consumers, which actually was very surprising to me. I wouldn't have guessed that there were that much, and that's multiple hundreds of millions of dollars that consumers spend right now. And we axed out a large chunk of useless fitness type apps and things that get banned by FCC because they say they cure acne with the light, things like that. Those are all gone, and still, multi-$100 million that people spend right now on health-related things. And most of them, even of those, even though they are anything decent, they're not very good either. So it's really kind of a vetting out of those type of things right now. That was one of the funnest things I got in the last year, was how much consumers already are paying for healthcare through a different channel that was never there before, like the App Store. It just shows that if the way you position it for consumers, as anyone in here that knows more about consumer marketing than I do, that's all it is. It doesn't matter about the value to the consumer. So it's the real hard part for all of us is doing something that is valuable to physicians and people. And so those are two very different things. And it should be about their health, but it's not all the time.
I'm Greg Antone. I'm with a company called Legacy Health Strategies, and we work on patient activation, product adoption side of things. And we actually do, to the earlier question, work on the behavior management, behavior modification side, so I'd be happy to talk to anyone about that. But I'm curious about patient adoption of technologies, of the products, of telehealth. What did your study show in regard to how is the utilization curve kind of increasing here?
Well, what we've found in a lot of these things is that the key to the patient adoption is always going to be somewhere, or it traditionally is, and it's going to be for a while, somewhere within the physician. For example, I used the quote of like managed care back in the 90s was, 70% of all people that were surveyed said they hated their managed care. But then when they actually checked those people, only like 30% of them were actually on a managed care program. It was just, and the reason why did they say that? They said it because their doctor said it. They walked into their visitation to the doctor, and the doctor bitched about it. That's the nature of how adoption is right now. People still listen to their doctors, and to some extent always will. There's a little bit of discussion around that, how it could be changing and people are becoming more independent. But how does PERS work? PERS works because there is a referral model involved in that, whether it's through a nursing home or through a physician themselves that says, hey, you're going home, this is your elderly person, why don't you buy this? There is some sort of key to that for the use of technology always in any of these markets that we discuss. It's different when you use the internet as an enabling aspect, and a lot of that actually is very new, and we'll see how that all plays out, even social media, Facebook, all of that right now. We'll see the longevity of that kind of engagement and how well it will work with healthcare. But in general, for a device and an actual technology in someone's hands, they put some of this great stuff in a pharmacy, no one will ever buy it. There's a mental gap there. You pay for a treadmill, but you don't pay for a glucose monitor. I mean, that's just the way people think. And in the US, it's less than other countries because we do have public pay, but it's still there. And so that's kind of a real interesting conundrum as far as engaging the patient around device use, actually. Because the best things that's happened over the last couple of years is we've had these managed service providers show up that actually go out and implement these large-scale system setups. And those are great because in the past it's fallen on the kind of niche people that provided those to do that, and that's a huge task to undertake. So anyways, I think my time is getting close here. Actually, 3 minutes over. Is there anyone last question? I didn't want to leave someone with the mic. No. She's starting to scroll.